there is no need at this point of time for booster shots for people coming even from the vulnerable groups. The only group that may require a booster are those immunocompromised individuals. So we are looking very closely at the evolving evidence, and we don't have a recommendation as yet that vulnerable people require a booster unless they are immunocompromised. When we have better evidence, we will be in a position to recommend such a recommendation, provide such a recommendation. In the interim, we continue to say that the best use of vaccines will be to vaccinate the unvaccinated vulnerable people.
Why did WHO call for a vaccine booster moratorium? What is the current situation of the global vaccine supply?
As we have highlighted, there is still a huge vaccine inequity issue globally, and some of the most vulnerable people in the world have not been able to access even a single dose of the vaccine. In light of this, WHO is asking for a moratorium on booster doses. But let me also clarify what we mean by a booster dose. It means a third dose for people who have already received 2 doses of a vaccine. And really, we don't have the evidence that people who've already received 2 vaccine doses of WHO-approved EUL-granted vaccines require a third dose. The evidence we have, looking very closely, is that all WHO EUL-listed vaccines still are effective in preventing severe disease and death. And the only exception to this is when those 2 doses have not been able to generate the required immunity because certain people have immunocompromised situations in their bodies, and those people may require a third dose. Now, when we're talking immunocompromised people, it may be elderly, it may be people who have other immune problems that may require a booster dose. Besides that, we are not seeing a need for population-level booster dosing at this point of time. This is an evolving situation. WHO is working very closely with many of our research institutions and partner organizations to gather better evidence. But in the interim, our current position is that since the vaccines are effective in preventing severe disease and death, that it is more important to address the global inequity in access to vaccines. For example, if we look at it, WHO requested countries to ensure that 10% of the most vulnerable people are fully vaccinated by the end of this month in September and 40% by the end of this year. If we look at it, 90% of high and high middle income countries have already reached that 10% target. And more than 70% have actually reached the 40% target. But unfortunately, not a single low in middle income country has reached the target, either of these targets. So we are nowhere near vaccine inequity, and the problem actually is that as long as there is vaccine inequity, as long as there are vulnerable people who are not protected, we leave room for the virus to multiply, we leave room for surges of outbreaks, whether they are driven by new variants or not, and this then results in further mutations. So that is why WHO is urging for a moratorium on booster doses unless they are absolutely indicated in the case of immunocompromised individuals, so that more equity can be achieved globally through vaccination.